No. What happened, man?
My name's Leslie Junkin. I have one daughter, Isabella.
I'm a money cat. Good old boy.
I know, that's when you were born.
You chill.
We live here next door to my mother in Columbus. Isabella is 17, and she is probably one of the most interesting people I know. She has tons of personality. She likes to cook, and she never forgets anything. We've often said if we could figure out how to get her as interested in education as she is in what's on TV and how to design her clothes and what ingredients go in a recipe, then we wouldn't have any of the educational struggles that we do. You've already told me, she said I was an old lady. She really enjoys her people, as she calls them. And if you're one of her special people, then you're in a really good place. We had a normal pregnancy and normal delivery, no indication of a problem. When she was 3 months old, our pediatrician said, you know, I'd like to run these tests. She's not meeting some of the developmental markers that she should, and we just want to rule out the possibility of Down syndrome. People have said, you know, how did you cope with it? I said, well, it was always for me an issue of, I can't fix this. I came home, I started calling other pediatricians and said, here's what's happened. They had us set up with early intervention, and we started therapy within 2 weeks.
When we think about health and health outcomes, most of the time people think about health care. And yet when you look at the data, health care only affects about 20% of the outcomes that we see. You have genetics, which is about 10%, health behaviors, that's about 40%, environment, that's about 30%. Health care is critically important, but it's only one of the determinants of health and health outcomes that we need to think about. So the social determinants of health underlie all of those issues.
Access to health care, education, income, culture, and where you live are some of the social determinants of health. They contribute about 80% toward an individual's health and well-being. One condition that is highly associated with poor health and has the most dramatic effect on the young is poverty.
Mississippi's poverty rate is higher than most other states in the country. You can't have a conversation in terms of what the connection between poverty and children's health without talking about the social determinants of health.
Leslie Junkin works 2 jobs and has private health insurance. She says she's fortunate to have income and health insurance because Isabella's intellectual disability is associated with chronic diseases. The first of these chronic diseases was diagnosed when she was 6 years old.
It was February of her first grade year. The teacher called and said, she's acting a little strange today. So we went and picked her up and went to the doctor, and her blood sugar was over 700 that day.
Type 1 diabetes is most prevalent in children under the age of 20. Nearly 167,000 patients with type 1 diabetes have been reported in the U.S. The Diabetes Foundation in Mississippi says that at least 1,800 children in Mississippi live either with type 1 or type 2 diabetes, and the numbers are growing.
In the space of 30 minutes, I went from parenting a child with Down syndrome, which was okay, to giving my child insulin injections. At that point, Down syndrome became secondary. That's who she is. We don't really even think about that anymore, because if we can't manage the health issues, then it doesn't matter what the developmental problems, seem to be.
Isabella has been diagnosed with a series of autoimmune diseases, including juvenile diabetes, polyglandular autoimmune syndrome, and celiac disease. Celiac disease and diabetes both require a special diet.
Grocery expenses on a good month, we spend about $600. And that's just to keep her food in the refrigerator that's fresh food, that's not processed foods. There are some options that are out there that are not quite as expensive, but again, it's not fresh foods. It's not the healthier foods that would be a better choice for her when it comes to providing a diet that is not only going to help her health, but just help her overall.
On this day, Leslie drives 300 miles round trip from Columbus to Jackson so Isabella can see a specialist for an eye infection.
We're in Flowood, so we can go and see Dr. Palmer today about
For
your
Leslie,
eye.
getting Isabella to the doctor is more
And you got a
complicated
you
than
got a
just the
rash somewhere, a
drive.
rash on your chest. Okay, we'll let her look at that too. Transportation, it's always a concern. You know, do you have the money for the gas to get there? Do you have the money to buy lunch? If it's going to be a trip that puts you in the middle of the day, because she is diabetic, you always have to pack, you know, do you have stuff you can take with you to make sure she doesn't get low? Let them try so that they can see how the lotion makes your skin look better.
Put that mad hair.
Well, it'll be okay if you're mad. You'll be happy when you get there and see all your friends and all the ladies that you know at Dr. Palmer's office.
I'm not bad.
Just say in the last year, we went to Jackson 8 times for doctor's visits. Okay, that's 3,000 miles on a car. That's 8 tanks of gas. That's 8 meals at a minimum, not counting I missed a day of work every time that we went. And plus she misses a day of school.
Traveling far distances to see doctors is considered normal for many of Mississippi's rural residents. The state has one of the nation's worst doctor shortages. Access to doctors and the healthcare system determines whether sick people get better and how well chronic diseases are managed.
We have to check in with Granny and tell her that we made it to the doctor, okay? I just have to send her a text and tell her we made it to Jackson so that she doesn't worry about us. Now she knows that we made it, and then we'll let her know when we get ready to leave that we're finished. Do you want me to sit by you?
Yeah.
Yes? Okay, I can come and sit by you. Come here, it's okay. Shh. It's all right. Don't cry. Oh, goodness, this ponytail is just everywhere. Don't cry. It's okay. It'll be all right. It'll make your eye feel bad if you cry. I know. You want to blow your nose for him?
No.
You don't want to blow your nose for me?
Mm-mm.
And I have so many friends who say, well, I'm embarrassed to go and try and get food stamps, but I can't afford to feed my kids. You know, I had that conversation with a family member last weekend. She said, I went and applied for food stamps, but they said I make $50 a month too much. She's got 4 kids at home. Out here. She's trying to see what's in there. It's a rabbit. There might be a rabbit or a squirrel in there. And in the shame that comes with that, and you are made to feel ashamed.
I laid in the hospital for 12 weeks. I told myself then, if I didn't get out of the state of Mississippi and get somewhere where there was other options, that I knew I wouldn't be there another month or 2.
47-year-old Pamela Jacobson was diagnosed with rare glandular cancer at age 40, but cancer was just the beginning of her health problems. Radiation therapy designed to kill the cancer cells damaged her arteries and colon, and surgeries to repair the damage became routine.
When you feel death inside your body, and then you go home as sick as you are, and you've got to make that decision, do I pack everything I've got on $600 check and go for it, or do I stay here and let my family watch me die?
At 5 feet, 10 inches, and 108 pounds, Jacobson says she was dying and that traditional medicine wasn't working. This led her from her home in Philadelphia, Mississippi to Canyon City, Colorado to try legalized medical marijuana.
I had my doubts. You know, nobody is certain when they head out for an adventure like this, and I knew this adventure would either make me or break me. And here I am.
The cannabis plant, which is commonly called marijuana, has been used as medicine for thousands of years in many cultures. In the early 20th century, marijuana was used in the U.S. for pain relief and to treat other ailments. By the 1930s, marijuana as medicine had fallen out of favor due to the development of pain medication and federal regulations. Prescriptions for marijuana declined, and in 1941, marijuana was removed from the official book of medicines in the U.S.
Cannabis, cocaine, and some opioids were available over the counter in the 1890s and early 1900s, and people were using them for mood elevation and other things. There was no scientific establishment at that time to do studies on them to find out whether they were beneficial or not.
By the 1990s, a couple of states allowed marijuana for medical use. Today, medical marijuana is legal in 29 states and Washington, D.C., and 12 are poised in the next year to vote on legalizing it. West Coast resident Brian Hill has used cannabis to treat his ailments.
I've been a medical marijuana patient in the state of Oregon for about the last 6 years. I was suffering from debilitating arthritis. I was referred to a pain clinic, and I went to a regular pain clinic to a psychiatrist and had it, I was evaluated for between opiates or medical marijuana, and I chose the medical marijuana route than go with the opiates.
Recent studies by the National Institute on Drug Abuse, or NIDA, found that legal access to medical marijuana at dispensaries affects patient opioid use. For example, there were fewer prescriptions for opioids, a drop in admissions to drug rehab, and fewer overdosing deaths. It also found when medical marijuana was legally available, it saved more than $165 million in Medicare prescription drug costs. Medical or recreational use of marijuana is not legal in Mississippi, but Mississippi is one of 16 states that allows limited use of cannabidiol, or CBD, which is an extract of the marijuana plant.
The bill moving through the legislature would provide a form of medical marijuana in Mississippi.
And I would have to educate people to say, look, this is not marijuana that we're dealing with. This does not have THC. There's no street value. You can't get high from it.
She's been flown to the hospital.
Senator Harkins authored Harper Grace's Law, named after a little girl with a rare form of epilepsy called Dravet syndrome. Mississippi allows for CBD oil along with a handful of southern and midwestern states. Even though CBD oil is manufactured in states that have legalized marijuana, Mississippi law requires the Natural Products Center at the University of Mississippi to extract CBD from the pot plants it grows. The center in Oxford is the only federally funded research facility permitted to legally grow pot. CBD oil dispensed in Mississippi has to come from or be tested by them.
You know, the lab up there is a FDA certified lab. DEA certifies that lab. I mean, it is strict controls. We know the product that we're making there. We know the ingredients that are going into the product. We know the solution that's coming out.
But the CBD oil cannot be used as is to give to the patients. It's got to be formulated. Any pharmacy right now in the state, whether it's compounding pharmacy or regular pharmacy, and even with this law, cannot sell CBD oil unless they have a Schedule I controlled substances registration with the DEA.
A Schedule I classification by the federal government means drugs are illicit, illegal, have no medicinal purpose, and are unsafe, even under medical supervision. In 1970, the federal government classified marijuana as a Schedule I controlled substance. The Drug Enforcement Agency says Schedule I drugs have high risk potential for abuse. Many prescription painkillers, including opioids, are in Schedule II.
In the marijuana plant, there are at least 90 compounds that are organically active, not all of them on the nervous system. There are probably more than that. We really don't know how many there are, to be honest. The two that are most clinically relevant, meaning the ones we talk about the most, are THC, which of course most people have heard of, but that's the cannabinoid that has the side effects of marijuana that you typically think of with recreational use. And CBD, or cannabidiol, which is a sister compound to THC that we think has some degree of anti-inflammatory effects, as well as working in the nervous system.
A lot of people that want medical marijuana can't stand the free weed movement because it's two different movements, it's two different issues, and so it kind of clouds a judgment, and people get caught up in the hysteria of people, oh, you're voting for marijuana. Well, no, I'm not voting for marijuana.
We do not know the effect or the pharmacology of each one of those compounds in the cannabis plant. We know only for a few.
My interest in using marijuana as a medical compound really came out of advocacy for my patients and the legislative sector.
First, let me express my sincere appreciation for your consideration of this topic and your time today. These patients are often
using a cannabinoid that is an organic compound in marijuana has been suggested anecdotally, meaning people have said that it's been suggested to help in the care of people with refractory epilepsy.